Yeah, so I wish this was going to be the high-risk MDS conference. I think I would have been really excited to see the AZA-TAMI. We know that the trial press release negative, but still seeing those data would have been really critical. We're still waiting on Verona. So I really think what's most exciting here is particularly in the low-risk space. So we have, of course, luspatercept, moving indications to frontline. We kind of have fresh off the presses of the imetelstat approval. So how do we sequence, how do we best utilize these therapies? Do we utilize them early, before transfusion independence? Do we think about combinations with ESA, with each other? So I think there's a lot of presentations here looking at optimizing. One, can we start at higher dose of luspatercept, so start at the 1.75 milligram per kilo? Can we add ESA to luspatercept? We've published on this, but there's some prospective data in that setting. So I think a lot is, how do we further improve our clinical benefit with these therapies is really probably the biggest take home. I think we're going to see some early data and some additional data in the IRAK4 space, both with the Rigel compound and imvosertib from Curis, which has been more high risk. So I think there's some interest there, but really probably optimizing low risk HI experiences, with erlitacept also coming in a pivotal phase 3 and some updated data here. I think that's probably what's most exciting MDS, but maybe a little bit underwhelming at this conference than I would have loved.